Welcome to HECOIN, sponsored by Health Education and Counseling Institute, the premier online educational institution in Jamaica, the Caribbean, and beyond. Come and Relax with HECOIN is an interview and discussion segment which focuses on topical issues which may be controversial on health, aggression in proximity relationships, theology, business, politics, music, tourism, and hospitality, or issues which are relevant to you, our listening audience. This program is aired this and every Thursday at this time on this station and comes to you on several international media houses in the world through various platforms on website, YouTube, and Facebook. I'll be your host, Ambassador Professor Reverend Dr. Colin O'Neill Jarrett from Jamaica, President and CEO of this 33-year-old institution. HECOIN, reaching people where they are, leading them to where they should go.
I shout your name, I praise your name, God. When I look at the mountains, the sky and sea, I shout your name, I praise your name.
Oh Lord, my God, you made humanity
a little less than your divinity.
Oh Lord, my God, we marvel, you are great. You crown us with your glory and your love.
I have found Come and Relax with HECOIN to be interesting and an insightful program. Wherever I am, I can't afford to miss the speakers and what they have to offer. When is the next program again?
When I look at the heavens, the moon and stars, I shout your name, I praise your name, oh God. When I look at the oceans, the beasts of the sea, I shout your name, I praise your name, oh Lord my God.
Welcome to Come and Relax with HECOIN, sponsored by Health Education and Counseling Institute, the premier online educational institution in Jamaica, the Caribbean, and beyond. Come and Relax with HECOIN is an interview and discussion segment which focuses on topical issues which may be controversial on health, aggression in proximity relationships, theology, business, politics, music, tourism, and hospitality, or issues which are relevant to you, our listening audience. This program is aired this and every Thursday at this time on this station and comes to you on several international media houses in the world through various platforms on website, YouTube, and Facebook. I'll be your host, Ambassador Professor Reverend Dr. Colin O'Neill Jarrett from Jamaica, President and CEO of this 33-year-old institution. HECOIN, reaching people where they are, leading them to where they should go.
I shout your name, I praise your name, God. When I look at the mountains, the sky and sea, I shout your name, I praise your name.
Oh Lord, my God, you made humanity
a little less than your divinity.
Oh Lord, my God, we marvel, you are great. You crown us with your glory and your love.
Greetings and welcome to Come and Relax with HECOIN, which comes to you today from Mansell East meets West Indian Restaurant, Shop 16, Sony's Plaza, Main Street, Oteria, St. Anne, Jamaica. Call Latoya or Hensel for your restaurant booking at 1-876-601-2612 or email info@coreyhouseja.net. Excellent setting here at Mansell East meets West Indian Restaurant for meetings, weddings, and other events. Sorry for the delay, but we had technical difficulties. I'm your host, Ambassador Professor Reverend Dr. Colin O'Neill Jarrett. Let me thank the following media houses for airing Come and Relax with HECOIN: RCP Internet Radio and TV, YouTube and Facebook, TDN TV on vstreams.com, TDN TV on Facebook, TDN Network 1 on YouTube, UFDV Gospel, and DCM Internet Radio and TV. We'll take a break. We'll be right back.
Hi, I'm Indra Jamnani, a proud graduate of HECOIN Montego Bay Campus, Jamaica, where I did a 6-month course in Elderly Care International Diploma Level 2. What I love about the program is that it was intriguing. The environment was soothing, and the tutors are registered nurses with degrees and have a wide knowledge of experience. I received credit in my theory and distinction in my practical, and will be pursuing a career in nursing. My experience on the practicum site was tremendous, because when I was on practical, everyone there thought I was already a certified nurse, and not knowing that I was just a student. HECOIN has an excellent payment plan. You don't have to worry about how you're going to pay your tuition fee. You don't have to borrow a student loan. No, all you need to do is get yourself registered, make your first payment, and then make monthly payments afterwards. HECOIN is one of the best nursing institutions to attend because their certifications are recognized internationally. Being a HECOIN graduate makes me a proud nurse, and with HECOIN, your dreams become reality. Choose HECOIN.
Monkeypox is an illness caused by the monkeypox virus and can be spread from person to person. Based on the World Health Organization (WHO), there have been 14,000 cases worldwide with 5 deaths. Diabetes, on the other hand, is a chronic health condition and affects how your body turns food into energy. Come and relax with HECOIN, the voice of Health Education and Counseling Institute, the premier online international training institution, will look at monkeypox and diabetes management. HECOIN feels honored and privileged to have as our guest in Come and Relax with HECOIN, founder and president of Midtown Atlanta Nephrology PC, Dr. Frita McCrae Fisher, a medical doctor in the USA who has been triple board certified in nephrology, internal medicine, and pediatrics. She's a philanthropist, businesswoman, and a dynamic, humorous speaker and a publisher. Her commitment to medicine and education, however, go far deeper than the eyes can see. Join host, marketing and media specialist, health educator and administrator, and professor of media studies for over 30 years, Ambassador Professor Reverend Dr. Colin O'Neill Jarrett from Jamaica, as he discusses with Dr. Frita on the issues of monkeypox and diabetes management. The date to remember, Thursday, August 18, 2022 at 7:30 p.m. in Jamaica or 8:30 p.m. EST on various international platforms all across the world, including the websites, Facebook, and YouTube on RCP Internet Radio and TV, DCM, UFDV Gospel, and all platforms of TDN. HECOIN, reaching people where they are, leading them to where they should go. Wow, wow. Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Your body breaks down most of the food you eat into sugar, glucose, and releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. There are 2 types, type 1 and type 2 diabetes. We will also look at how diabetes can be managed. Monkeypox, which was first documented in humans in 1970, is caused by the monkeypox virus, a member of the same family of viruses as smallpox. Although it is much less severe and experts say chances of infection are low. 14,000 cases of monkeypox have been detected globally, with 5 deaths up to when I did the promo you heard earlier. But with checks this morning, it showed 12 deaths. The first segment of Come and Relax with HECOIN will be on diabetes and its management, and the second will be on monkeypox. However, for obvious reasons, more time will be allotted to be interviewed and the discussion on diabetes, since that is more fatal than monkeypox. We have a special guest with us on Come and Relax with HECOIN, who has been a household name to HECOIN. our YouTube sessions with our healthcare students at HECOIN and to other groups to make persons aware of health risks and symptoms of illnesses in the guest room of Come and Relax with HECOIN. We have with us founder and president of Midtown Atlantic Nephrology PC, a medical doctor in the USA who has been triple board certified in nephrology, internal medicine, and pediatrics. This makes her unique as there are not many MDs who are triple board certified. She's a philanthropist, businesswoman, and dynamic humor speaker and a publisher. Dr. Frita McCrae Fisher. Welcome to Dr. Frita. And how are you today? See, they are getting tongue twisted. Accept warm greetings from all of our listeners today from Jamaica, the Caribbean, and beyond. Greetings to you and happy to see you almost face to face. How are you? Could you unmute your mic, please? Your mic. Could you unmute it? It's unmuted? I do have that challenge sometimes, but we are not hearing you.
All right, can you hear me now?
Yes, I'm hearing you now because we need to
All
hear
right.
you. We need to hear you. How are you in Jamaica? We'd say, how you do? How are you?
Great. I'm very excited to be here and excited to talk about these topics. Thank you for having me.
You're most welcome. You're most welcome. And we'll get straight into it. You know the discussion already, and I have watched many of your presentations on YouTube. I tried in the best way to define diabetes. But as a medical expert, can you define diabetes for us? And is diabetes only associated with adults?
So diabetes is when you have excess sugar in the blood or hyperglycemia. So every one of our cells, Dr. Jarrett, needs sugar or glucose to survive. We have to have sugar inside of our cells. Well, when you have diabetes, you don't have the ability to properly get that sugar in the cells because you need insulin. Insulin acts like the key to unlock the door to the cell to get the sugar inside of the cell. For people who have adult onset diabetes or diabetes mellitus type 2, they may have a lot of insulin, but the insulin does not work. So basically, their bodies are resistant to the insulin. They have insulin resistance. So they have a lot of keys, they have a lot of insulin, but their keys are not able to unlock the cells to get the sugar in. And so they get hyperglycemia or high blood sugar in their diabetes. Children can indeed get diabetes as well. They have diabetes mellitus type 1, also called juvenile diabetes. In that case, they don't even have enough insulin. The cells in their pancreas are not making proper amounts of insulin, so they don't have enough keys to unlock the doors to get blood sugar into the cells. So that's what diabetes is: hyperglycemia, high blood sugar, and it has many, many potential complications.
Okay. Can you state for us, Dr. Frita, 3 main symptoms of diabetes?
Oh my goodness, there's so many symptoms.
So many.
But one of them is urinating frequently or having polyuria. So with all of that high blood sugar that is floating around in the body, it has to go somewhere. And so it's filtered out through the kidneys. Well, sugar or glucose is a large molecule. And so when it's filtered through the kidneys, water follows. And so when you have diabetes, you may find yourself urinating a lot, not only in the daytime, but getting up 3, 4, 5 times at night to urinate. So frequent urination is one of the symptoms. Well, if you're urinating frequently, you can imagine that you may become dehydrated. So what will you do? You will drink excessive amounts of fluid. So excessive thirst is another symptom of diabetes. And then there's unintentional weight loss. I mentioned that every cell in the body needs glucose for energy. But if you have diabetes and that sugar is in the bloodstream and not inside the cells, then you have high sugar in your body, but it's not in the cells. And so then you don't have energy. So extreme fatigue and unintentional weight loss are other symptoms of diabetes.
Okay. Based on your YouTube session, can you quickly list for us 10 early signs of diabetes?
Oh my goodness. So we've talked about the frequent urination, the frequent thirst, excessive hunger, unintentional weight loss. You can have poor wound healing. You can also get blurry vision. You can get diabetic neuropathy, so you can get tingling of fingers and toes. You can get gastroparesis, which can cause nausea, vomiting. You can get abdominal pain when you have diabetes. than just the excessive fatigue. You can also get yeast infections in the genitalia, which can lead to itching in the genitalia. And there's so many more even than that.
Mhm. What does diabetic urine look like and smell like? What color is healthy urine in an adult?
Very good. So we'll start with healthy urine. So healthy urine in an adult should be very light. It should be almost clear with just the faintest tinge of yellow. And we urinate every day. And so everyone kind of knows how their urine smells, but they don't really think about it. There should not be a strong or offensive odor in healthy urine. Okay, so clear with just a slight tinge of yellow. For patients who have diabetes, it could go a few ways. You can have very clear urine if you're trying to get rid of excess water, but if you have an infection like a urinary tract infection, and people with diabetes are often predisposed to infections, then your urine may be dark, cloudy, have a very foul, offensive odor. That's a possibility. Another issue is that diabetes is the #1 cause of kidney failure. And if you have kidney failure with diabetes, you could leak protein into the urine. Protein causes the urine to be very bubbly or foamy. And so a diabetic's urine may be foamy, it may be bubbly, it may have the signs of the urinary tract infection or other things even beyond.
Mhm. Can diabetes go away? What is its treatment?
That's a really good question. So diabetes can be treated even to the point where you may not need insulin or medications. But once you are labeled as a diabetic, we typically don't say that it goes away. Now, we'll give one caveat. If you have diabetes and kidney failure and you get a kidney pancreas transplant, well, with that pancreas transplant, then now you have an organ that's making proper insulin, and you may have been on insulin before, and now you may no longer need the insulin if you get a pancreas transplant specifically. And then if you have diabetes, specifically type 2 diabetes, and say you have it largely because of a risk factor of being obese, because when you have a lot of abdominal obesity or belly fat, that decreases your insulin sensitivity and it can predispose you to diabetes. Well, if you lose a considerable amount of weight, so then you no longer have that excess belly fat, the abdominal obesity, it's possible to come off the insulin, to come off of the pills for diabetes. We don't say that the diabetes has gone away. We say that you are a diet-controlled diabetic. So does diabetes miraculously go away? No, but there are ways to get off of medications potentially.
Right. You spoke about going to the bathroom 4, 5, 6 times. What is the average time or average number of times an adult is to go to the bathroom? I know that's dependent on intake, but yeah.
Exactly. It's going to vary from person to person, how much water intake you have. But in general, if you get up to use the restroom maybe 1 or 2 times to urinate at night, that's considered to be within a normal realm. But if you're getting up 3 times, 4 times, 5 times, that's considered to be nocturia, urinating at night, and it can be a symptom of diabetes, and it can also be a symptom of some other things like prostate disease. But typically 1 to 2 times or less is what's considered to be normal as far as getting up at night to urinate.
And that's an 8 to 10 hour sleep, or adults don't need so much?
Well, they say the average adults need 7 to 9 hours of sleep. That's going to vary as well. But that's what I'm talking about in a typical 7 to 9 hour time period.
Very well. As Caribbean people, I'm sure you have heard of us, and maybe you have practiced on many of our Caribbean peoples. What should diabetics avoid eating? Or is moderation that is being promoted now?
Absolutely, I believe in moderation, because I find that when I tell patients to absolutely never have certain items, they don't listen to me. And so I have to be realistic and work things in. So of course, diabetics are going to want to avoid excess refined sugars and high foods that are very high in carbohydrates. You don't want to have a lot of cakes, a lot of breads, a lot of rice, and even fruits. Even though we think of fruit as being healthy, many fruits are high in sugar. And so for diabetics, they still have to count those carbohydrates. In general, they should have just a heart-healthy diet where you have more plant-based food on your plate than not. So we typically think of fruits and vegetables as being the side items, but for diabetics, I want them to think of the fruits and the vegetables as the main items, making up the majority of the plate that is prepared, and then perhaps your protein or your lean meat can be the small side item. So lots of fruits, lots of vegetables, lots of foods that have anti-inflammatory agents like antioxidants and beta carotenes, things of that nature. Most importantly, limiting the carbohydrates and the refined sugars. That's what diabetics should do.
All right. What are the risks of diabetes during pregnancy?
Oh, yes. Yes. So if you get diabetes during pregnancy, that's gestational diabetes, you are at risk if you're someone who is obese, which obesity is defined as having a body mass index or BMI of 30 or greater. You're also at risk if you're overweight going into pregnancy. So if that BMI is between 25 and 29, if you have a family history, if you have a sedentary lifestyle where you're not exercising, all of these things can put you at risk of having diabetes and even having gestational diabetes. The thing to remember is that even if you're a person who did not have diabetes before the pregnancy, and even if the diabetes gets better immediately after pregnancy, if you have diabetes during pregnancy, you are at risk for having diabetes long term. And so even if you're a young, healthy woman of childbearing age, you want to make sure you follow up even after the pregnancy with your physician to do everything you can to prevent developing diabetes.
There is a fruit in the Caribbean called the lychee. Some people call it lychee. I'm sure you're aware of it because I've heard you speak on that topic. Many Jamaicans love this fruit. Is it good for diabetics, Dr. Frita?
Oh my goodness. Oh my goodness. So lychee just in general is a
Mhm.
fruit that is filled with vitamin C, vitamin B6, niacin, riboflavin, folate, many, many healthy aspects of it. Potassium specifically is a substance that's in lychee that can be very healthy because when you have a high potassium diet, assuming that you don't have risk factors that prevent you from eating a lot of potassium, in general, high potassium can help to lower blood pressure, right? Because the more potassium you take in, the more sodium you urinate out. And also potassium helps to release the tension in blood vessel walls, which is good for blood pressure. So there are many health benefits. And there's some studies that even suggest that there can be help with dementia. There can be help with other things. A lot of them are animal studies. We don't know how that necessarily translates to humans, but the potential is there for lychee to really just be a healthy fruit. The issue with diabetics is that lychee, even though a fruit, does have high sugars. It does have high sugars. So I encourage all diabetics to consult with their physicians or with their endocrinologists to find out if you're going to partake in lychee, what should be your limitations, because you still have to count the carbs when eating fruits that are high in sugar.
What about yellow yam? I'm sure you know of that.
So
I've heard that diabetics should avoid that, even in small quantities. What do you think?
I think that it's loaded down with carbohydrates, and so it could add to a huge part of the carb count. Again, I really encourage diabetics to talk with their physicians because a diabetic who is, say, very poorly controlled may have a stricter diet than someone who is very well controlled or even diet controlled. The one who's more well controlled may be able to, in moderation, have some of these items that we're speaking of. But in general, they have to be aware of the carbohydrates and the sugars that are there.
All right. As we wrap up our discussion on diabetes, many persons I have observed are suffering from neuropathy. I hope I've got the pronunciation correct,
Yes.
which is associated with diabetics. I want you to bring us through that. Can you explain this, as it is a very painful process?
Yes, yes. So diabetic neuropathy, or an abnormal pathology of the nerves, is something that's quite common in diabetics, especially diabetics who do not have those blood sugars under control. It can affect really any nerve in the body. So typically you'll hear of people with diabetic neuropathy having a numbness or tingling in their fingers and their toes as a result of the neuropathy. And this can really be an issue, especially with the feet, because if you have someone who wants to walk outdoors with no shoes on, enjoy the earth or the sand or the grass under their feet, if they have a decreased sensation in the feet due to diabetic neuropathy, if they step on a splinter or a small nail or something that pierces the skin, they may not even feel it. And so they could walk around with having this compromised skin for weeks or even months, and that can lead to infection. The issue with that is that diabetics tend to have poor wound healing. And so an infection can turn into gangrene, a diabetic ulcer. It can even lead to amputation. So this is one of the potential consequences of diabetic neuropathy. You can also get neuropathy of other vessels, such as in your digestive system. You can get a situation where you're unable to digest food properly. The esophagus, that tube that connects the mouth to the stomach, may in some aspects be somewhat paralyzed. What happens with that? Then you get nausea, you get vomiting, you're not able to properly digest your food, and it can lead to malnutrition. So that's another issue that plagues patients who have diabetic neuropathy. Another very important thing, lastly, I'll say, is the way that you experience a heart attack. Many diabetics have atypical presentations, not typical, because they may have a heart attack and not have chest pain because their nervous system, their neuropathy may cause them to just have a referred pain. There are many diabetics who will have a heart attack and their only symptom is nausea or pain in the stomach. Yes. So if you're a diabetic and you're having some pain in the stomach, epigastric pain, nausea, sweating, shortness of breath, and you're really not sure, you really need to seek medical attention because you could be having an atypical presentation for a heart attack, largely related to diabetic neuropathy.
Wow, Dr. Fritter, you have been a blessing to all of us by providing this useful information on diabetes. We could go on and on and on. Managing diabetes, could you just speak on that for a minute or two? How do we manage diabetes?
You definitely want to get the lifestyle under control. You want to have a heart-healthy diet, as we talked about, have a diet that with limited carbohydrates and sugars. You want to exercise. According to the American Heart Association, you should be exercising 150 minutes per week, so about 30 minutes for 5 days a week. And that can help with maintaining a healthy body weight and also maintaining healthy blood sugars. And so prevention is really key. As far as the management, you definitely need to seek medical attention because it will vary from patient to patient, but having a healthy diet. Some patients will need insulin, even type 2 diabetics. That high insulin can sometimes impair the pancreas from making adequate amounts of insulin. So you may need insulin, or you may need certain pills that can help the blood sugar to stay low. So there are multiple managements, but prevention is key when you can. And so you want to be of a healthy body weight. You want to have a healthy diet and to try to prevent diabetes if at all possible.
I'm sure you have heard of bush tea. But perhaps yes, bush tea, some Jamaicans do that and it doesn't work out necessarily in their favor. 30 seconds, your experience in that area with your patients who try the bush tea.
Right. I think the greatest experience I had from patients with bush tea was actually during the pandemic, where they believed that the bush tea would be the cure. What I encourage patients to do is to really lean heavily on evidence for certain things. For certain diseases, we do have randomized controlled trials where we know what works, be it medicine, be it lifestyle. Now, food and tea, these things can certainly have medicinal properties, but I never want patients to kind of go rogue and say, hey, I'm just going to do my own research and I'm just going to drink this tea and it will be the cure for all. No, consult with your physician and understand that bush tea is not a cure-all, and not to necessarily to speak badly, but I just want patients to be sure to have an open mind and to understand that the best medicine is integrative medicine, where you understand lifestyle and using food as medicine, but that you also respect certain medications that do work as well. It can be a blended, integrative approach.
Excellent. When we return, we will look at monkeypox virus and what we need to know. Grab your bottle of water. Let us drink during this break. Don't move. Your dial will be right back. Do you want to study in a recession-proof career online? Health Education and Counseling Institute HECOIN offers International Diploma in Patient Care Technician PCT, which is a combination of nursing assistant, phlebotomy, and electrocardiogram through the American Medical Certification Association AMCA, which is internationally accredited. Visit www.hecoinglobal.com or call our WhatsApp 876-223-7204. HECOIN, your dreams can now be your reality. Health Education and Counseling Institute HECOIN offers certificates in housekeeping, food and beverage, customer care, security guard, events planning, and many other short courses, which are all offered online with 8 intakes each year. Visit www.hecoinglobal.com or call our WhatsApp 876-223-7204. HECOIN, reaching people where they are, leading them to where they should go. Royal Central Praise RCP Internet Radio and TV in St. Kitts invites you to listen to Caribbean News Brief CNB on Tuesdays and Fridays at 10 a.m. Join Caribbean veteran in news production and news presentation for over 30 years, Ambassador Professor Reverend Dr. Colin O'Neill Jarrett from Jamaica, for reliable and comprehensive news in the Caribbean. CNB on RCP every Tuesday and Friday at 10 in the morning. RCP, the breath of fresh air. Thank you for sticking and staying with us on Come and Relax with HECOIN. During our first segment, we looked at diabetes and its management. And in the final segment now, we will examine monkeypox virus. With us in the boardroom, we have our distinguished founder and president of Midtown Atlanta Nephrology, PC, a medical doctor in the USA who has been triple board certified in nephrology, internal medicine, and pediatrics. She's a philanthropist, businesswoman, and a dynamic, humorous speaker and a publisher, Dr. Frita McCrae Fisher. Welcome back.
Thank you.
As a medical expert, 3-time board certified, can you define for us the monkeypox virus and how it is transmitted?
Yes, the monkeypox virus is a DNA virus that is very closely related to smallpox, another member of the orthopoxvirus family. It can be transmitted through various ways. One way initially was from animals to humans, a zoonotic infection. It is historically endemic in Central and Western African countries and found to be in animals such as rodents, like mice, large rats, squirrels. And you could get monkeypox if you're scratched or if you were bitten by an animal, or if you were preparing meat or eating meat that had been infected with monkeypox. Well, now, as we see currently, monkeypox has spread. And there's always been some form of human-to-human transmission. When humans have monkeypox, they can give it to each other through close skin-to-skin contact. So if you have a lesion on your skin, like a blister or a vesicle, and you come into contact with someone through close hugging, through intimate contact, you can get it. You can also get it from touching the bedding or the linen or sharing an eating utensil with someone who's been infected with monkeypox, because it's a DNA virus and it can live on surface. Yes, and then you can get it from large respiratory droplets, not the tiny microscopic aerosolized particles like with COVID-19, but with monkeypox, if someone coughs on you, sneezes you, if they're really close to you, or if you're kissing them or exchanging secretions that way, you can also get monkeypox.
Could you tell us some symptoms of the monkeypox virus?
Yeah, so the symptoms initially are kind of similar to typical viral prodromes. You can get fever, headaches, muscle aches or myalgias. You can get lymphadenopathy, meaning swollen lymph nodes in the neck, in the chin. So these are some of the initial symptoms. And then typically 1 to 3 days after that fever, you get a rash. And the rash has different phases. It typically starts off as just some bumps or some macules, like a macular papular rash, just some fine bumps. And then it progresses to fluid-filled lesions or blisters, also called vesicles. From there, it turns into pus-filled lesions or pustules. And it can last from 2 to 4 weeks, and you are infectious until that very last pustule dries up and scabs over.
But I noticed they tend to show the pictures of the perhaps the latter stages, which looks very ugly. When those bumps go down, the pussy bumps, how does it look?
Well,
does your skin go back to normal?
It can vary from person to person. Now, of course, we talked about how monkeypox is related to smallpox. Now, smallpox was more severe. And if you go back and you look at some of those historic pictures, they had those deep disfiguring lesions that typically lasted. With monkeypox, some of the lesions can last, but most people, especially healthy people, tend to do well, and most of the lesions will go away. And there's not a high fatality to monkeypox when you compare it to smallpox, for example, which has been eradicated since 1980. But I will agree, Dr. Jarrett, monkeypox is not a pretty disease. You don't want any part of it. Nevertheless, most people tend to do well, but who wants to go through it?
If I have monkeypox, what should I do to protect other people from being infected? And in your response, Dr. Frita, should persons abstain from sex when they have the virus? And are gay men at greater risk? Because we hear the WHO talking about gay men. Good.
See, now that's the question. Is it a stigma or is it?
Yes.
My goodness. Well, to answer the initial, if you have monkeypox, you need to quarantine. You need to go and get away from other people. And you don't just quarantine from people. The CDC actually recommends that if you have pets, you quarantine from your pets also.
Oh.
Because we know that it's a zoonotic infection, that it can be in animals. The last thing we need is for monkeypox to get into animals, and then we really won't be able to control it. So you quarantine from people and from pets. You also want to really pay attention to your symptoms. Most patients are able to do well and they don't have to be hospitalized as long as you're able to drink well, as long as you can handle the pain of the lesions. But if it's severe, unbearable pain, then you need to put on a mask and you need to put on some long sleeves, and you let the facility, the hospital, your doctor know that you have monkeypox so they can properly protect those around you and can properly clean and make sure things are sterile. The other thing, if you have monkeypox, you want to make sure quarantining is, yes, the most important thing. But again, if you're severely ill, you want to understand that there are certain treatments that have been approved. And if you need a medication, if you're someone who's immunocompromised or very elderly or very young either, if you get monkeypox, you can get treated. One more thing, even though we think about vaccines as being preventive, if you've been exposed to monkeypox, as long as you catch it, especially early on, like within 4 days, you can still get the vaccine even after exposure. And it can either prevent or certainly shorten or decrease the severity of your course of monkeypox.
Okay. Is my risk of becoming infected, developing serious symptoms, or dying from monkeypox higher if I am living with HIV?
That's a good question, because when we talk about people who are at risk, we often say that if you are someone who is taking pre-exposure prophylaxis, right, PrEP for HIV, if you are in a risk category, then you're likely at risk for monkeypox, theoretically as well. If you have HIV and you have, say, an undetectable viral load and a high CD4 count, if your HIV is very controlled, then you are not necessarily at a higher risk of getting very sick from monkeypox. But again, if you are someone who is that same person who's taking medications to prevent it, then you may be at risk for having it. Really, immunocompromised people are going to be at the highest risk of getting very ill from monkeypox. And you asked the question earlier, if it's a gay man's disease, it is not. Yes, we're getting reported in the numbers that men having sex with men have the most cases. These are the numbers that are being reported, and that may be true, but we also don't know if we have some selection bias. So in other words, if you don't look for something, you won't find it. If we're only looking for monkeypox and testing people in communities of men having sex with men, we may be missing it with other communities. And then we talk about that stigma. Say you are someone who is a heterosexual man, you're a straight man, but you have symptoms of monkeypox. You may not get tested because you don't want to be stigmatized. So I'm actually underdiagnosed, but it's not a gay man's disease. Anyone can get it, skin to skin, and even large respiratory droplets.
How common are outbreaks and what is its treatment?
So the outbreaks, this is when science really gets dynamic, because this is going to be an ever-changing answer. Prior to this current outbreak that we have going on in 2022, the last outbreak was in 2003 in the United States, where we had 47 cases that we believe came from some prairie dogs that had been in contact with some infected animals coming out of Africa. And so this is our first pretty big outbreak since then. But, we started off, at least in the United States, with just that one case in May. Then in the US, we went to the 240s. And now globally, we have tens of thousands of cases, and it's still rising. And so it looks like the outbreaks were not very common, at least outside of the endemic areas. But now, if you look at the numbers every day, the answer is changing to that question.
Mm-hmm. Are vaccines readily available for monkeypox? And do you think the public should be alarmed at this time?
Well, Dr. Jerry, I never like for the public to be alarmed or to be panicked, but the public should very definitely be concerned. Anytime you see a virus that we have not seen in certain areas, like we haven't seen it out of the endemic areas, and now it's spreading rapidly, it's kind of looks like it's going everywhere globally, you should be paying attention, you should be concerned. Vaccines are available. I don't know if I'll say they are readily available, because there's definitely a short supply. we do have vaccines. I know that in the US, we have an FDA approved vaccine, Jynneos, that's being offered. You can get 2 doses of it to be protected. 1 dose, 28 days later, you get the second dose. But to be honest, we have a severe shortage. Even for the community that we've identified as being high risk, we don't have enough vaccines to cover that community. Now, recently in the US, we had an approval to cut the dose by 1/5 if we give the monkeypox vaccine intradermally, meaning right under that top layer of skin, the same way like with the tuberculin skin test. And it's actually believed to be just as effective as the higher dose. And so it looks like we're going to be stretching out our monkeypox supply. Even still, it's not readily available, the supply for it.
This next question is a major topic because I've heard it by medical experts in Jamaica just this week. So you're coming on at a right time, Dr. Frita. What are the risks of monkeypox during pregnancy? And can it be transmitted to the unborn child, Dr. Frita?
Oh my goodness. The answer to that is that yes.
Wow.
Can be transmitted to the unborn child, to the fetus. And yes, monkeypox can also be transmitted to the newborn. We have documented cases of miscarriages, of preterm births or premature babies. We also have neonatal monkeypox or monkeypox that the newborn got from the mother. So absolutely, monkeypox in a pregnant female can be harmful to the baby. The issue is our data is somewhat limited because it just hasn't been collected very widely in monkeypox. We have more data for smallpox. Again, that has been eradicated where it needs to stay since 1980. Smallpox, we had, severe representations of miscarriages and stillbirths and all of that. But yes, a pregnant woman can transmit monkeypox to her unborn child.
And what would be the symptoms that would greet the doctor? Is it a blood test that would have to be done, or the birth of the child? The child would now have some obvious symptoms.
Well, if the mother were to have it, then definitely
yes.
The same way as non-pregnant women, you look for that fever, the prodrome, the lymphadenopathy, the swollen lymph nodes, and certainly the rash. And what in some cases, it's recommended that the mother have a C-section. For example, if there is a fear that the mother could have monkeypox lesion in her birth canal, you certainly don't want the baby passing through there. Again, though, we have limited data and something that's dynamic, and we're kind of learning as we go.
Right. Can the monkeypox virus be spread through a blood transfusion?
Oh, that's a good one. According to the FDA, there have been no documented cases of monkeypox being spread through blood transfusions globally. So at this point, it has not been documented. So right now, monkeypox being spread through blood transfusion is something that is theoretical. You never say never, but it has not been documented thus far to have been transmitted through blood transfusion.
Is there a test to see if I have had monkeypox in the past? If I have had monkeypox in the past, can I get tested anywhere?
Well, we do have the ability to do the test, although right now that's not something that is widely available or to the general public. But if you were to take a look to see if you have had an antibody response, any antibodies for monkeypox, then you know that you've had a previous infection. And likely, that could be protective. But right now, the only thing that we're doing is testing for active infections for the general population. So, if you were in some type of a clinical trial, then perhaps you would have that, but it's not a test that's readily available. But the answer is yes, it is possible to test to see if you have antibodies to monkeypox in a previous exposure.
All right. There are many Jamaicans and in the Caribbean that travel widely. And so United States is just another place that they visit. Tell us a little about your company, because I don't want you to leave without talking about your company. I feel the energy in you already. I want to invite you to Jamaica. Yes. Tell us a little about your company. It started and what exactly you do there.
Oh, absolutely. So I'm the founder and president of Midtown Atlanta Nephrology, where I take care of patients with kidney disease. I try to prevent or to correct their kidney disease. If that kidney disease progresses, then I'm also the medical director of a nonprofit dialysis unit, DCI, where I care for patients. And I also encourage patients with kidney failure to get kidney transplants. And I take care of post-transplant patients. The other thing I do beyond the walls of my office, beyond the walls of my dialysis unit, is Dr. Frida. So I want everyone listening, please grab your smartphone, go to your computer, follow me on Dr. Frida. That's Dr.Frida, T as in take care of yourself, A. There, I have my YouTube channel where we're up to about 470,000 subscribers. I have multiple videos on all types of
I am one of them.
Yeah,
My students. Yes,
we
go
talk
ahead.
about it all. So please subscribe, please follow me. And I promise you that I give a variety of information, and I give it just in plain, regular terms where everyone can understand, and then they can use it to help themselves to be healthier and even happier. And I'm hoping that people will share it with others. The other thing I'll do a lot of media appearances. And as you mentioned, I'm a publisher of my book.
Take it out and show it. Oh, yes. Under pressure.
Under Pressure, a guide to controlling high blood pressure. You can get this on Amazon.com, or if you go to my website, drfrida.com. In this book, I talk about ways to manage high blood pressure, not just the typical ways with medicine, although I definitely do talk about medicine, but I also talk about how to use food as medicine. For example, using high potassium foods like apricot, spinach, broccoli, lima beans, pinto beans, nectarines, kiwis, salmon, foods you wouldn't even know. I talk about ways to use food as medicine, lifestyle, and how to have an integrative approach to treating high blood pressure, which is a silent killer and the number 2 reason that people end up on my dialysis. I also have a podcast, Healthy Happy Life podcast with Dr. Frida. If you follow me on Instagram at Dr.Frida, I keep you up to date on everything I'm up to, including my appearance tonight. I post those things on Instagram. I post them on Facebook as well.
Your final word to the entire world listening you, hundreds of thousands of people. What can they take from you tonight about diabetes and monkeypox virus?
As far as the diabetes, there are ways to prevent diabetes if you don't have it. Many people say, oh, diabetes just runs in my family. Well, guess what else runs in families? High carbohydrate diets, high sugar diets, sedentary lifestyles. And so we don't have to be prisoners to our family history. Be your own advocate, step out, do what you can to prevent diabetes. And even if you've been diagnosed, there are ways to potentially get off of the insulin if you have type 2 diabetes. And so you want to manage it the best way possible. Be your own advocate. You have to speak up for yourself. Ask your doctors questions. And as far as monkeypox, you want to make sure that you continue following the evidence as it comes out. If you follow me on at Dr.Frida, I'm always talking about something. I'm going to post something tonight on something new that's come out on monkeypox. Don't be fooled by the stigma. Yes, right now it happens to be being reported in one community, men having sex with men, but don't get caught sleeping like the world got caught sleeping with HIV, where you think it's just for those people over there. Anyone can get monkeypox. So you want to be careful. You want to wear a mask when you're around people you don't know, especially, or when you're in close contact. You don't want to be skin to skin. If you're in ride shares, or on surfaces, you want to go back to cleaning them with Clorox. Don't be fooled by the stigma. Anyone can get monkeypox. Protect yourself.
Can you share your website again and your telephone number? So we ask persons to get out your pen. If not, then you'll have access to the website. Go ahead, Dr. Frida.
Absolutely. And the website will have everything in it, including contact number. It's www.drfrida.com. So DRFRIT as in take care of yourself, A.com. There you can actually have links to my YouTube videos, linked to my blogs, links to purchasing my book, links to my various television appearances, such as when I'm on HLN or Fox Soul or various things that I've been on, Paternity Court. All of that will be on my website, drfrida.com. Again, follow me on Instagram because I post when I'm doing community services and things of that nature.
You spoke about your media experience, and that is my baby. Did this start in college? Did this start in university? Where did this start?
Not at all. This started in my living room at home just a few years ago. I would see patients, Dr. Jared, and they would say things to me like, I like the way you explain things. Or I like the way you talk to me. I wish my doctor would have said it that way. And so then I decided to start taking things outside of the 4 walls of my office. And I was like, well, you know what? Maybe if I start a YouTube channel, then, I can reach more people, since my patients really tend to kind of gravitate towards me and they like what I say. Well, at that time, my youngest daughter saw me with my little iPhone and my YouTube, and she was like, "What are you doing?" I was like, "I have a YouTube channel." She's like, "Well, how many followers do you have?" I was like, "I have 3." She was like, but now fast forward a few years, we're now up to about 470,000 subscribers. So all of this started really just a few years ago, just before the pandemic. Now, before that, I've always been a speaker. I've always enjoyed speaking. Now speaking at church, and then mama making me do speeches here and there and, in the community. So I've always liked speaking. But this media, where I've been on Paternity Court and HLN and Fox News and Fox Soul and Roland Martin and BNC and all of these national news shows, that's been a new blessing and kind of a transition that I'm enjoying very much in my career.
Very well. I will say hallelujah to that. I'm not afraid to say that. It's a Christian institution, Health Education and Counseling Institute. Dr. Frita McCray Fisher, you have again blessed us with your wealth of knowledge on the airwaves of several media houses on this platform. Your commitment to medicine and education go far deeper than the eyes can see. You have really opened our eyes to what we need to know on behalf of the world. I'm not going to even say HECOIN, the entire world. I thank you, Dr. Frita, for being with us today. You are an authority on so many aspects of medicine, not only nephrology, internal medicine, and pediatrics, but on quite a few other areas of medicine. We are indebted to you for the sterling contribution you have made on Come and Relax with HECOIN to the world. Thank you again, my dear, and God bless you, Dr. Frita.
Thank you. God bless you as well.
Thank you so much. For persons who wish to make a donation to Come and Relax with HECOIN and what's on for next week are in the queue. Stay tuned. Come and Relax with HECOIN is a feature of Health Education and Counseling Institute HECOIN, the premier online educational institution in the Caribbean. For individuals, companies, and foundations that wish to donate or contribute to this program, which is primarily to provide solutions to the worldwide issues of the day, please call in or WhatsApp your donation. 1-876-223-7204 on Thursdays between 8:30 p.m. and 10 p.m. EST, or during work hours Monday through Friday 9 a.m. to 5 p.m. EST, or email president@hecoinglobal.com. HECOIN, reaching people where they are, leading them to where they should go. In 1962, the late Reese and Egbert Miles started the Haddington Basic School in Eastern Hanover until they retired and moved from that community. Their dream was that every child in the community had the opportunity to receive early childhood education. The legacy continues with the children, especially Joan and Junior Miles, who continue to live out the dream of their parents in the renaming of the school remake, Risa and Egbert Miles Educational Center. Come and Relax with HECOIN, a 33-year-old international training institution, will interview Joan and Junior Miles, administrator and principal respectively of Remake, children of the founders. HECOIN believes in generational wealth and family business, especially those with an educational focus. Join host, marketing and media specialist, educator, and professor of media studies for over 30 years, Ambassador Professor Reverend Dr. Colin O'Neill Jarrett from Jamaica, who is in the second generation of leadership at HECOIN, as he discusses the dream of Remake with Joan and Junior Miles, who are also in the second generation of leadership of Remake. The date to remember, Thursday, August 25, 2022 at 7:30 p.m. in Jamaica or 8:30 p.m. in other parts of the world on various international platforms all across the world, including the websites, Facebook, and YouTube of RCP Internet Radio and TV, DCM, UFDV Gospel, and all platforms of TDN. HECOIN, your dreams can now be your reality. Relax with HECOIN came to us today from Mansell East Meets West Indian Restaurant, Shop 16A Sonis Plaza, Main Street, Oteria, St. Anne, Jamaica. Call Latoya or Hanser for your restaurant booking at 1-876-601-2612 or email at info@coreyhouseja.net. Excellent setting at Mansell East Meets West Indian Restaurant for meetings, weddings, and other such events. Let me thank the following stations for sharing the platform and for making this program available to you. RCP Internet Radio and TV, TDN TV on vstreams.com, TDN TV on Facebook, TDN Network 1 on YouTube, UFDV Gospel, and DCM Internet Radio and TV on all its platforms. Today's show will be uploaded on YouTube in less than 30 minutes on Central Praise SKB, that's Central Praise SKB. We are still in Jamaica 60, and so I will leave a beautiful poem from the Honorable Dr. Louis Benny Coverley OJ, Dotty Tough, a poem done in the Jamaican language. A thought for us this week: the best investment that you can ever make is on our health. Join us this and every Thursday at this time for Come and Relax with HECOIN, sponsored by HECOIN. I am Ambassador Professor Reverend Dr. Colin O'Neill Jarrett, President and CEO, and in the second generation of this 33-year-old flagship training institution in Jamaica, the Caribbean, and beyond, Health, Education, and Counseling Institute, HECOIN. Now receive the benediction. May the strength of God sustain us. May the power of God preserve us. May the hands of God protect us. May the way of God direct us. May the love of God go with us this day, now, and forevermore. Amen and amen. Walk with my friend.
The ground is hard. We chose this poem because it is very relevant to the times now, though these verses were written many years ago. But Dotty Tough means not just that the ground is hard, but the times are hard. So it's rain or fall, but Dotty Tough. The rain is falling, but the ground is hard. And Dotty is not just a corruption of the word dirty. It's a real African word, D-O-T, Dotty, which means the ground, Dotty Tough. Sun a shine, but things not bright. Do a pot a boil, bickle not enough. River flood and rain a fall. Rain a fall, but Dotty Tough. Nowadays, the times so hard. When you ask Maddie how them do, them afraid you take it, tell them back, so them not answer you. Not care how much we da work for hard times, still in our shot. We da fight, our time a beat we. They might raise we wages, but £1 gone and pound we pay and we not feel no merriment. For £10 gone and pound we food and £10 pound we rent. Saltfish gone up, mackerel gone up, beef and pork gone up same way. And when rice and butter ready, them just go for holiday. Cloth, boot, pin and needle gone up. Ice bread taxes, water rate, kerosene, oil, gasoline gone up. And the pound devaluate. The price of bread gone up so high that we have to agree to cut we hype and bread and all turn dumpling refugee. And all them maga smaddy, whether go on like fatty sin, all them they whether fast with me, I left them to dumpling. Sun a shine and pot a boil, but things not bright, bickle not enough. River flood, rain a fall, but water scarce and Dotty Tough. Oh, yeah.
Miss Lou, that could really have been written today. When did you write that, in fact?
Nearly 40 years ago. You remember, you notice I use pound.
Yes.
Because in those days, we